So I just want to start off by setting the tone for the difference between these two statements here. So thinking about what can I do to help my child with stress and anxiety versus the subtle difference of what can I do to assist my child's effort to cope with stress and anxiety. And again, it's a subtle difference, but it is somewhat of a big one in terms of emphasis, where that first statement is really putting a lot of the responsibility on the parents on what they can do to fix everything. And parents can have a big role, of course, but this second statement really is still talking about parents doing a lot to help their child, but trying to put some more responsibility on the child as well in teaching great coping skills and ways to deal with future problems. And so these are similar questions, but a little bit different in the focus. So, like I just said, parents can really make a difference and can make an impact on reducing anxiety in their children. I'm going to show you this slide a little bit later here with the potential relationships between anxiety, adaptive skills, and parental factors. But what I want to start off with an overview is just kind of explaining things we've shown in the past. So we know that anxiety in children can affect adaptive skills, which is your functioning in the everyday world, kind of independent living skills, things you need to get by as an independent adult, and that these two things are quite related. We also know from the literature that this bidirectional relationship between parent and child also affects how anxiety manifests, but also how a child with anxiety affects parental behaviors and stress and other things like that. And definitely we know that obviously how you're raised and reared will affect how you learn the behaviors that you need to take care of yourself as an adult. So we keep coming back to the relationship of these three items here. So the influence of the home environment. Children learn behaviors from watching you. This includes how you do things that are important for yourself. So coping with stress, how you handle tough situations, how to find things that make you feel good about yourself, how to take good care of yourself, which includes, diet, exercise, resting, taking time to recoup. Those are very important things. How we respond to disappointment, and then how we treat people with respect and value relationships. These are all things that can really be modeled for children and are quite powerful. As you've seen before that we've showed you, anxiety is quite common in 22q. About 40 to 60% of children with 22q may present with an anxiety disorder or some symptoms, and what we most commonly see are specific phobias and separation anxiety, with specific phobias being more things like intense fears, so certainly a fear of the dark or fear of spiders, things like that. Those are what we're talking about when we say specific phobias. Separation anxiety, so having a hard time falling asleep without a parent, or having a really hard time even just separating, so going to school or getting dropped off at daycare being a really difficult situation for children. And we see that hanging around a little bit longer in some kids with the deletion, as opposed to what we typically expect of any child, when they're 2, 3, 4, or 5. Generalized anxiety, when we say that, we're talking more about kind of that general worry that's just always around, kind of feeling anxious but not necessarily being able to put your finger directly on what it is that's causing that. Social anxiety, and that can mean anything from not feeling comfortable talking in front of a group, to really having a hard time approaching an individual, or impacting friendships. Those things you'd see affected by social anxiety. And it's obsessive compulsive disorder or behaviors, where you have obsessions or recurrent thoughts that kind of come over and over again, and then the compulsions being the responses or the behaviors that you do to reduce the anxiety that's caused from these obsessions. So any of these types or multiple combinations of these disorders can be present. That, in addition to children having to deal with the medical conditions that are often present, usually sometimes even severe in the early years, anxiety on top of learning difficulties and on top of social impairments and difficulties with peers. So all of this adds up. It's a lot to have to deal with. We showed this slide before just to kind of give you a feel for what I just said about what was most common in children with the deletion here. If you look between these two yellow lines, those are what average scores are in the typical population. And this is what's reported by the child, and this is what's reported by the parent. So anything above this line of 60 here is significant or high. And some of these things that aren't quite above 60 but are close to it, you're seeing that children are saying that they're having a lot of panic symptoms, a lot of separation anxiety, physical injury, and that is probably to be expected given a lot of medical procedures that these children have gone through, as well as obsessive compulsive disorders. And you're seeing a similar pattern. Parents are seeing very similar things to what the child's reporting. So separation anxiety, physical injury, and then generalized and obsessive compulsive symptoms also high. And so when we talk about anxiety, some of the background is that there are risk factors, but there's also protective factors that we need to consider also. And so certainly there are genetic factors that contribute to anxiety disorders. Exposure to stress can definitely contribute to the feeling of anxiety. Socioeconomic status is both protective or is a risk factor. So how many resources you may have to help deal with some of the stressors that are going on. And then having developmental delay on top of anxiety is a risk factor. Some protective factors are things that help us adapt to adversity or stress, include genetic factors again, supportive families, having that social support, temperament, or what we kind of consider more personality traits. Those can be very protective against certain types of anxiety. This is a really important one here, locus of control, or the perception of how much control you have over what happens to you in the world. That's a really big deal as far as being able to adjust to perceived anxiety. Problem-solving skills, those are important in order to help us respond, as well as self-regulation and having a positive perception of oneself. And as we showed you before, kind of what I was pointing at on the right hand of that triangle, anxiety affects real-world functioning, what we call adaptive skills. So that's a measure of self-sufficiency, the ability to manage everyday needs in things like communication and self-care, and these are things that are needed in order to become an independent adult. So it does vary according to developmental level, and so examples of self-care skills, for a younger child might be getting dressed, whereas for an older child or adult, it's more the whole process of getting ready from, choosing your clothes, bathing, putting on, getting your hair done, all of these things. Things around communication that fall under adaptive functioning is being able to ask for help when needed. Navigating in the community, that's also kind of a complex skill. Things like figuring out how to ride a bus or get around on public transportation, or ordering food in a restaurant. These are all of our examples of what we talk about when we say adaptive skills. This is important because it predicts functioning in children with disabilities. And in most populations, adaptive functioning is correlated with IQ. So we think that the higher your IQ, the better able you are to get by in your everyday living skills. And what we see in the group of kids with 22q that we have here, with anxiety being low to high here on the bottom, and then adaptive skills being low to high here, where high is good for adaptive skills, and anxiety here, high is bad. So we see these kids doing well, good adaptive skills for those people who have low anxiety, which is a good thing. But when we look at IQ, as I just told you how we expect in typical populations and even in other populations like Down syndrome, higher IQ being related to better adaptive functioning. This line goes up as we go towards the right. However, in children with 22q, we see a big scatter here. There doesn't seem to be much of a relationship. And our hypothesis or thought about why this might be is that the high rates of anxiety are interfering with one's ability to use your cognitive potential and apply it in the everyday world. So the home environment, as I mentioned earlier, the parent-child relationship is a two-way street. It's not really a this and then that. It's always evolving, and it's a balance between the relationship. So we know that anxious behaviors in the child can affect parenting style. And parenting style can support healthy behaviors. So this is always in flux and affecting each other. Many studies have demonstrated that the mom's emotional state and rearing behaviors can be closely related to child's temperament or their kind of personality as a baby. On the other hand, several studies show that child's responses to parenting also have a significant effect on the mother's emotional state. So just another example of that back and forth. To give a little bit of an example here, these slides are borrowed from Elliot Beaton, who was here and now in the University of New Orleans. If we look at a scale of maternal depression, anxiety, and stress, and we have the group with 22Q here and typicals here, and we're talking about mothers now, we see depression in green, anxiety in blue and what's reported, and then stress here. So if you look at depression and anxiety, actually they're not quite that different between the groups. There's a little bit of more spread or variability, so more wide ranges of responses in the 22Q group, but not necessarily that different. But we do have some outliers, some very extreme responses compared to the typical developing group here. And what we do see is stress does seem to be, again, this wide range here. So if we take the mother who reported the highest depression right here, and we try to map out and see what does the child report. Let's take a look. And here what we're showing are the different subscales of the MASC. It's an anxiety scale. And here are the different little subscales here. And if we see in gray and blue, here's the 22Q group, and here's a typically developing control group. Here in red is the child of that mother that we just saw. And what you see is that in almost all of these areas, or multiple areas, there's very significant anxiety symptoms that are being reported by the child. So that was just illustrating the earlier point there. There are many dimensions that we can look at when we're talking about the relationships between parent and child. One is critical versus warm, and another is emotional over-involvement as opposed to supporting autonomy or independence. So what do we mean by this, over-involvement? Because it's normal to be protective and to be involved in your child's life. That's the job of the parent. But sometimes when we get off balance, that's what we're talking about. So that may end up looking like overprotection or too much control, or some of these parents end up really sacrificing a lot, almost too much on their part. And it affects both the parent, him or herself, as well as the relationship with the spouse. And also, this can lead to self-blame. So as I've mentioned before, maintaining balance is really what we're trying to get at, and what Tony had mentioned earlier. It's a natural response to be protective of our children, especially ones that do have real limitations, and especially ones that have been vulnerable and fragile with a lot of medical issues. But with time, we also need to build the skills that are needed for independence and vary the amount of support we provide. So these are slides that both Ingrid Lechleiter, our psychologist, and Tony have showed you before about maintaining this balance. We don't want to be so low that we're not providing enough support, but we don't want to be doing everything for our child to the point where by the time he or her is an adult, he's not able to do anything on their own. It's really finding that balance of meeting the child where they're able to be to function, and then pushing just a little bit more so they're continually moving forward. That's the ultimate goal in mind. But that's always hard to be thinking in that big picture when you have small hurdles to come along the way every day. And so this is a reminder just to help us get through there. And this is a really nice visual just because it's really that idea of balance, right? Not going over too far one way or the other. And I think the other point I'd like to make also is that this is continually changing over time. So what we thought was working for us 2 years ago, we're always having to reassess and kind of say, okay, well, maybe things have changed and he's grown in this way, so we need to give a little more. And so based on the literature, looking at these two domains, and the flip side of these domains are the warm and the supporting autonomy, we see that being related to child anxiety. So obviously being warm and being supportive are related to lower anxiety. And that's anxiety disorders. In children with intellectual disability, we see that it seems like the over-involvement, the overprotection, the doing more for them, has greater effects than really the critical sort of behaviors. And so that's related to more intellectual impairment in the child, but again, that's probably because the child is less able to do much and the parents are adjusting to that. But it does take its toll, because those families do see more marriage problems and less social support. So just to go back to the statement, what can I do to help my child with stress and anxiety, versus what can I do to help my child cope with the stress and anxiety? And you know, it would be great if any of us as parents, regardless of the deletion, could keep our child from having anything bad ever happen to them, but that's not what life is. There's always going to be something, and you want them to be prepared to be able to handle that. So given that we're always going to have bumps in the road, it does make sense to try to equip your children with the skills to be able to handle some of those bumps in the road. And you can help them do that. That's definitely something that is a very powerful influence on children. And it goes right back here to what we were saying before, how we can kind of help reduce the anxiety in our children and then get them the better adaptive skills, as well as what we directly do by showing them how we do things. I'm just going to end here talking about one of the treatment studies that have looked at what parents can do and how successful they have been in helping to reduce anxiety. So this study here was looking at preschoolers that were at risk for anxiety in the general population, and tried to see if a parent training could help reduce the development of anxiety in these children. And so we know that kids who have increased inhibition or withdrawal, so that's a temperament state, or kids that are kind of shy and not very outgoing, or more hesitant, that's basically how they're describing them. We know those children are going to be at higher risk for anxiety disorders. And so he put these families through a parent intervention for 6 weeks. And what these sessions looked like is they were 90-minute sessions, and it went through 6 weeks, and these are the topics they went through. So the first was educating about anxiety and the development of anxiety. Then it was explaining the role of overprotecting and how that maintains anxiety. So kind of a signal, an unconscious signal that's being sent out when there's a lot of overprotection is that there's things in the world that are scary, which is true, but sometimes that gets kind of overblown or inflated more than it should be. And that's how those behaviors kind of maintain anxiety, because it's kind of priming children a little bit more to be looking for things that they might be scared of. The next part was really focusing on helping to get the parents to change or cognitive restructuring of how children perceive the world. So it's really working on teaching the child how likely is that event going to happen, maybe. So let's say it's a child with a phobia of a hurricane, and they live in a place where they really don't happen that often. So trying to work on that component of rationalizing, this is a fear of mine, but how likely is it to happen? It's actually pretty unlikely, so that should help bring my level down of anxiety. And then exposure hierarchies, being more of kind of what we were talking about with giving those little opportunities to try a little bit. So putting children in a little bit more uncomfortable situations in controlled amounts, so small at first, and trying to get them more comfortable. And then the last week was kind of working on integrating all of the above weeks before that. And what they showed was this was successful. Parents really made a difference, both at 1 year and at 3 years of follow-up. Significantly less anxiety symptoms in the group that got this intervention, and this was implemented by the parents, not the therapist, versus the control group that didn't get any kind of instruction. It lasted for 3 years, and that, these personality or temperamental traits continued. That didn't change. That was still the same in the child, but the development of anxiety in these children was greatly reduced. And Dr. Enriquez is going to talk next about different types of interventions similar to this and a little bit different as well with more detail. So you can see what it really looks like. So some tips for healthy coping: having realistic expectations, modeling good coping strategies and problem solving, including taking care of yourself, being able to reduce stress is great, increasing a child's sense of control. That can be very, very helpful, especially when a lot of anxiety is coming from this feeling of I don't have control over things. So finding the small things that someone may have control over can really empower an individual. Helping children identify their feelings. And then don't jump in too early. One intervention kind of uses this mantra of watch, wait, and wonder. And then go ahead and jump in if you need to after that. So I really want to thank everyone who's participated in our studies here, especially Elliot Beaton and Kiati, who have helped provide some of the slides that you've seen today. Janice and Ingrid, our wonderful psychologists, who've given a lot of input here, and of course Tony for everything that he does for the lab and for the families.